Hi guys, welcome to the long anticipated video about sinus mucus. And yes, on a Saturday night, sinus mucus requires wine. So grab a glass of wine with me. We're gonna learn why you have postnasal drip. We see a lot of patients in the office with complaints about drippy, runny noses. The truth is that this is how the nose and sinuses are supposed to work. Almost every nose creates about 1 liter of mucus, 1 liter. That it's created in the nose and the sinuses, it drains into the nose, into the back of the nose, into the throat, we swallow it, it's usually no big deal. The problem comes when something is triggering the nose and sinuses, stimulating, inflaming, irritating the nose and sinuses, so they create more mucus to wash or rinse out whatever it is in the nose. The interesting thing comes in trying to figure out what is that underlying stimulus or trigger for your nose to create the problem with the postnasal drip. There's 2 big categories. The first is allergic. This is your pollen, trees, weeds, cat, dog, dander, etc. Pretty self-explanatory. The second category is a little bit more nuanced and interesting, and it's generally called non-allergic rhinitis. There are some big categories under this. The first one is called infectious, self-explanatory, common cold, bacterial sinus infection. The next one is called autonomic or vasomotor. This is a little bit more situational. So the nose can become inflamed and create more mucus and swelling in cold environments, changes in humidity, exercise, stress, big trigger that we don't talk very much about, as well as certain foods and drinks. So alcohol, big trigger for nose and swelling and mucus, and spicy foods. Next category is drug-related. So interestingly, a lot of medicines that we take on a regular basis that are common can cause side effects in the nose and the sinuses. These include blood pressure medicines like beta blockers, your metoprolol, erectile dysfunction medications, overuse of nasal decongestants like Afrin, antidepressant medications, and anti-inflammatories such as aspirin, NSAIDs, COX-1 inhibitors, and some ACE inhibitor medications like lisinopril. Another big category is hormone. And I apologize, ladies, but a lot of this drills down to changes in estrogen levels. So 20% of women who are pregnant in their 2nd trimester will have nose and sinus changes related to changes in their estrogen levels. Other common triggers will be puberty, sexual arousal, the use of oral contraceptive pills, and the menstrual cycle. And it sort of drills down to the balance of estrogen in our bodies. Another common one that's not well known is low hormone levels of your thyroid gland. So hypothyroidism can be a trigger for rhinitis, the creation of more mucus and congestion problems in the nose and sinuses. I hope you learned something. Enjoy your wine, and thanks for joining me on a Saturday.